Hello, everyone. This is Dr. Richard Fleming, and today is Tuesday, September 22nd, 2020. After many months, the research that we've been conducting around the world on COVID-19 is beginning to trickle in. For me, that's a satisfying period of time as we begin to see answers to questions that we've been looking for almost 9 months now. Answers to the same types of questions you've been looking for, which is, how contagious is COVID-19? What are the treatment possibilities? Is a vaccine necessary? What are the benefits of social distancing and masking? And the list goes on, but those are the top ones that hit most of us. Masking and social distancing and vaccines right now seem to be the political and social issues that many Americans and people around the world are facing. Every weekend, as I turn on social media sites, I see protesters talking about how COVID-19 isn't real and this is all fictitious and made up, and it's all about governments trying to control the people. And where I won't conclude that governments aren't taking advantage of this, the foundational arguments that many of these people are using are fundamentally flawed. And you can't solve a problem if the questions you're asking and the basis, the foundation of your answers are quicksand. The building won't stand, it will crumble. Thinking about the government individuals that are running agencies and in charge of deciding policy and laws, I would be hard pressed to accept the argument not to vaccinate everybody if I were to follow people like Cowan and Kaufman and Young who are convincing people that viruses don't exist. Viruses aren't something that our body make when we're not feeling well because of toxins around us. Viruses are infectious agents that come from outside people, eventually came to people, and then get passed back and forth between people. And it makes people sick. It makes them ill to varying degrees. Without comorbidities or problems with the immune system, that may be as simple as just not feeling well or having sniffles or slightly elevated temperature, to those who have the comorbidities who are dying because, frankly, they haven't been treated correctly by the medical establishment. Now, the first is on all of you, and the latter part is on the medical establishment. But I can't very well defend people's rights if they're arguing from ignorance. And the concept that viruses don't exist, or whatever fantasy you're working with, if that's your argument, I can't stand there with you and defend you. On the other side, for those of you who have a grasp on reality and understand that viruses are real and that they're passed back and forth between people, this is an opportunity to try to come to grips with COVID-19 and anything else that happens in the future, because I think we have now established that when there is a virus or an infection going on, that the general public, all of you, will now be brought into the loop. I don't know if that's necessarily the right thing to do, but over the last several infectious agents with SARS-1 and MERS and Zika virus and a variety of other infections, it has now become obvious that the general public is going to hear about viruses and will be intimately involved in the discussion. For that reason, it's going to be very important for you to become more educated, not less. For those of you who want to pretend viruses aren't real and the earth is flat, I wish you all the best. I'm not going to be able to help you directly, perhaps indirectly, but directly, there's really nothing I can do for you. And listening to you is much like listening to an elementary school come home from school touting out new terms and words that they've heard at school, and they believe that they fully understand the terms that they're using. And it's always great for people to learn, but when they conclude that they know much more than they actually do just because they're familiar with a term, well, That's sad, and it's incorrect. University students frequently feel like that when they go to university because they come there thinking that they know everything. And then on their lower level courses, they hear a new term only to be taught at the more advanced level of training that they fully don't appreciate the information and the terms that they've been taught. But they had to be taught something to kind of get their foot in the door for understanding. That's kind of where all of you are. And to that extent, that's one of the reasons for writing the book Unmasking COVID, to provide you more with than just an elementary level understanding, because you're going to need to know this. And you're going to need to know this not only so you don't panic from the duration of COVID-19 or influenza A or whatever new virus comes down the road, or bacteria or fungus or whatever, but you're going to need to know it so that you can actually defend your civil rights and know what you're talking about. You can't convince the federal government or anybody else to not mandate something if the arguments you're using aren't solid. I think if the CDC has taught us anything, and Dr. Fauci has taught us anything with NIAID, and HHS has taught us anything, and all the rest of the federal agencies, is that their flip-flopping around demonstrates they don't really have a good handle on something that they should have a good handle on. In medicine, there really are two different types of doctors, physicians. There are those that are very good at learning and memorizing, and then when they see it again, treating it and responding to it. But those individuals, while they constitute the majority of physicians, aren't the type of doctors that can handle something new. And I've had a chance to see this ever since I was in medical school when HIV came out. As long as people knew what the disease was and what the treatment was, most doctors could be trained to regurgitate that information ad nauseum in their sleep. That's part of the training, so that people don't die. The problem is the vast majority of physicians are not complex thinkers. And thinking through something new and understanding what's called the pathophysiology, the mechanism of disease, understanding what tests are available and how those tests are done, and what different treatments are possible and how new treatments might be implemented and old treatments might be implemented to improve for the new problem. Well, that thinking is left to a very critical few. And it's certainly not the people that are touting the fact that viruses don't exist. It's not the people that haven't been treating the inflammation and the blood clotting caused by COVID-19. And it's not the people who've been treating the vast majority of people on ventilators. It is the few and far between. I'm delighted to be that type of physician, and where I'm not somebody who routinely likes the day in and day out drudgery of just seeing the same old thing in time and time again. I do like the challenge of sorting through something new. That's the reason I came up with the inflammation and cardiovascular disease. That's the reason why I came up with FMTVDM, to actually quantify and measure changes in tissue. And that's the reason why I continued that work into COVID-19. One of the papers we're going to release here shortly is what happens when doctors in the outpatient setting treat their patients with drugs that fail. In the case of this first study, we're going to be looking at people that were placed on hydroxychloroquine and zinc, and they did not get better. It doesn't mean that hydroxychloroquine and zinc doesn't work, and you'll see that as we continue with more and more publications, as we dig through more and more of our data. But it also doesn't mean that everybody gets better with hydroxychloroquine and zinc. Hence the need to quantitatively measure what's going on in a patient with FMTVDM to determine what treatment worked and which treatment did not. As these papers come out, this will be a learning curve for everybody. For my colleagues that are doing research and that have shared some of their data with me from around the world, I know you're just as eager to see this out as I am. and to find answers for people from our data so that we can get back to not a new normal, but our old normal. Because truth be known, viruses aren't something new and they're not fantasy. There are treatments for this virus, very successful treatment, so that the people who become critically ill, who end up in the hospital, need not die. But unfortunately, this has been a learning curve for everybody. My hope is that those of you listening to this will appreciate what we bring to you in the book, Unmasking COVID, what we bring to you in the research studies as we start to share the data and the treatment, and that you will not be suckered into the myth and legends of the people who want you to believe that the world is flat and that viruses don't exist. I agree with you on trying to get rid of the masks. I also have this to say, which is for the people that have become emotionally and psychologically dependent upon these masks, you need to give them time to resolve that. You can't strip it away from them any more than you want to have your rights stripped away. For the people wearing the masks who believe you need it, if you firmly believe the masks are working, by all means continue wearing them, but don't be a hypocrite. Recognize that if the mask is working and you believe they work, then it's stopping the virus that somebody who doesn't wear a mask might be spreading. So, with that being said, this is the official announcement that we have collected and closed the initial research study. We may or may not open it back up for the questions that are there. This is also the official closure of FMTVDM being free. We've resolved the information with the study sites, and the pandemic, as far as I'm concerned, has come to an end. As we continue to release the papers and wait for them to be cleared by the journals for publication, as we start to talk about the findings, as we begin to give lectures and interviews, it's time to be cognizant of the fact that we have now entered the post-pandemic period of COVID-19.